I'm back and thank you for staying with Checkpoint. Now, there has been exponential use of technology in healthcare over the past few decades. In this next story, our health and science reporter Gloria Milimo looks at how health information system is helping to improve the quality of care in health facilities through a recently launched digital platform by the government dubbed Afya K.E. Take a look.
Experts say the digital revolution has taken different sectors to new heights through the advancement of technology. As they continue to dive deeper into technology and its various branches, in health, it's playing a vital role in clinical workflow solutions. These are increasingly becoming essential for hospitals and health centers. In state institutions, there is need to improve the quality of services offered and help counter errors. The current situation is compounded by labor shortage in the country's health sector. Hence, the government is leveraging use of integrated digital health platform dubbed Afya K.E. to ensure health facilities go paperless. This decision comes on the backdrop of healthcare being overwhelmed by heavy paperwork and manual processes. This facility at the University of Nairobi is a new dawn. The patient-centric information system has revolutionized its operations.
Good afternoon.
Good afternoon.
You want to be seen?
Yes, I'm seeing a doctor.
Can you have a seat? You will say you will be called by the nurse.
Okay.
The health facility handles between 200 and 300 patients each day. Initially, patients seeking services would be forced to contend with long waiting hours as the health workers processed the huge number manually.
The other thing that has happened is we are interlinked. We have satellite clinics. The system has interlinked us all. So even if a patient is seen at at one of the satellite clinics, we are able to view that from any other point of management.
The manual system of record keeping, according to experts, is not only inefficient but also labor intensive. The need for a seamless integrated system that increases the bandwidth of caregivers while also enhancing the quality of care by reducing medical errors has never been so welcome.
When we were using the file system, it is possible for someone to actually break off some papers or even hide patients' files when they have their own agenda. However, it was not a major problem, but those are challenges that we used to experience once in a while.
Results at the triage section are also keyed into the system. Here, the patient is subjected to tests ranging from blood pressure, oxygen circulation, weight, and also temperature. Later, the doctor is able to get the patient's information all the way from the point of entry.
I had come and had a cough.
Okay.
Yeah, so I've gone through the triage, so they told me to come and see.
From the routine questions asked during the diagnosis stage, they are able to recommend the appropriate tests required and medications needed to relieve the patient of their symptoms. The procedure ends at the pharmacy where the patient goes to pick their prescription, all this while without having any single written note from the doctor. All this thanks to connected technology that increases productivity and level of care delivered to patients.
We realized that we did not have the need of our patient at hand. So we tended to procure drugs based on whims and what we thought was necessary. And therefore we had overstocking and we had severe shortage of others. And that meant that most of the prescriptions that were being given to patients ended up being bought over the counter.
Is activated to be attended in the university.
Clinical workflow solutions like the Afya K.E. platform enables these facilities to become central hubs for storing and retrieving patient data. With this, an efficient IT infrastructure is paramount to assure proper management of the data, to ensure it is fully compliant with cybersecurity, patient data privacy, and data integrity rules and regulations.
We employ a myriad of measures, starting from the rudimentary one of physical security, where we ensure that our data center is physically safe. And then we do what we call a demilitarization zone, whereby we start by ensuring nobody can access our data. And then we allow only those who are authorized to access. And therefore, we filter out any unauthorized access. At the user level, we also train them to ensure that any data they are accessing, they know that they are supposed to keep it safe and secure.
Similarly, the data is also hosted within the government's data center. This is in line with the Data Protection Act of 2019 that classifies health data as sensitive.
We have the consultation, we have vaccination.
As the medical fraternity continues to leverage technology in various ways, there is no doubt that embracing the latest digital technologies have ushered in a new era of healthcare where patients receive more precise care. This also ensures that caregivers become more efficient and productive in facilitating an environment that promotes universal health coverage. Gloria Milimu, KTN News.
Coming up in the world of